Hello, my name is Byron Jones. I'm a board-certified physiatrist, and I've been in practice for about 34 years. My previous experiences include serving as the Chief Medical Officer for a large managed care organization, as well as being the founder and Chief Medical Officer for a multidisciplinary spine care center here in Denver, Colorado. Most recently, I've focused on the outpatient treatment of musculoskeletal disorders, neurologic disorders, and chronic pain. I'm here today to talk to you about a product called Verasome. I've always been a proponent of transdermal preparations in the treatment of chronic painful disorders, and have had considerable experience with steroid creams, anesthetic creams, anti-inflammatory creams, up to and including diclofenac, some of the compounded multimodal medications, and even over-the-counter products like Biofreeze, Tiger Balm, and CBD creams. While I had some success with these preparations, I always felt like we were lacking a product that could penetrate the deeper tissues and avoid some of the side effects that patients were experiencing, including drug-drug interactions. In my search, I was introduced to a company called Entourage who is working on novel, natural approaches to treat many of the disorders I see. As I started treating my patients with the topical cream from Entourage, saw an opportunity to help develop an even more efficacious formulation, resulting in the creation of Verasome. Indications for Verasome are abundant. I've used it to successfully treat sports injuries, bursitis, tendinitis, many forms of arthritis, rheumatologic conditions, and I've even started using it in my patients with frozen shoulder syndrome from strokes. It can be used in diabetic neuropathy, idiopathic peripheral neuropathy, and things like carpal tunnel syndrome, and even complex regional pain syndrome. The results I've experienced with Verasome have included decreased swelling, improved range of motion, and decreased pain. Even more importantly, I've seen tremendous improvements in quality of life, with patients having the ability to now go on vacation or do things they haven't been able to do for a long time. I believe Verasome would be a very useful adjunctive treatment option for many different practitioners. This would include acupuncturists, chiropractors, physical medicine and rehab physicians, neurologists, massage therapists, orthopedic surgeons, and functional medicine physicians. There are very few contraindications when using Verasome. One would be pregnancy in patients who are breastfeeding, as it hasn't been studied in this population. The second would be an allergy to any of the components in the cream, like aloe vera. Verasome is very well tolerated. Because Verasome is a transdermal preparation, the possibilities of drug-drug interactions are negligible. The actives in Verasome are harvested from the hemp flower, so it does contain trace amounts of THC, but less than 0.3%, making it federally legal in all 50 states. As there is virtually no systemic absorption of Verasome, the chances of showing up on a drug test are extremely low. However, we do recommend speaking with the HR department if an employer has stringent drug testing guidelines. Heat and sunlight can degrade the active components in Verasome, so it's recommended it be stored in a cool, dark place like a refrigerator. If the patient lives in a very hot climate, avoid leaving it in the car. Application of Verasome is very simple. Each bottle contains 30 cc's of product, which comes out to 60 full pumps. I recommend applying either a half or a full pump, about a pearl size amount, to the affected area as many times as needed throughout the day. Rub into the skin until fully absorbed. The onset of action can be as quick as 10 minutes and typically lasts between 4 and 6 hours. I generally recommend having Verasome in the office, and if a patient is coming in with a painful condition, have them apply it early in the visit, and you'll often find that by the end of the visit, they are already experiencing relief. I recommend the same for physical therapists, chiropractors, and other practitioners. Have them apply it prior to a treatment, and you will find that they will tolerate the treatment and even progress to other phases of treatment more effectively. In summary, I found Verasome to be a very safe, cost-effective, clinically efficacious addition to the patient's existing treatment regimen, providing both functional and symptomatic relief, improving quality of life, and empowering the patient to take greater control over treatment of their conditions.